Good afternoon, I'm Dan Burritt. Welcome to the CBC Vancouver newsroom. In just a few moments, we're going to take you live to a news conference in downtown Vancouver featuring BC's Premier and several other high-ranking officials. David Eby is set to announce changes to public drug use in this province. The government has been under fire from the opposition and others over issues of open drug use in BC connected to BC's decriminalization pilot project. We're still waiting for him to come to the podium, and as soon as that begins, we will bring you that live. But we want to bring in our legislative reporter, Mira Baines, who's been covering this issue in Victoria and beyond. Mira, thanks very much for joining us. Remind us about this pilot project and then some of the issues around it.
Sure. Well, some of the issues include communities calling for changes to decriminalization. They've been growing more and more concerned about public disorder. And there have been a lot of smaller towns, especially interior towns, that are really asking for drug use to be banned in all public spaces. There's been concerns about people openly using illicit drugs on beaches, in parks, as well as in hospitals. And so the BC Nurses Union brought that issue forward as well. And this was something that BC United brought forward in a memo from Northern Health. And so the BC Nurses Union commented and said, you know, they support harm reduction, but people are openly using drugs in hospital rooms, and some of these hospitals don't have the security or the staff to prevent that from happening. And in some cases, there were some WorkSafe BC reports which showed that there were people smoking fentanyl in hospital rooms. So that's been quite concerning. One nurse was pregnant when this happened. And so you have nurses, hospital workers being concerned. You have mayors of cities across BC being concerned. And some of those cities include Kelowna, Vernon, West Kelowna, Penticton, and Princeton. And then you have testimony from Vancouver Police and the RCMP to a House of Commons Health Committee early last week. And they really highlighted concerns over not having the authority to get people to move along if, let's say, they're using illicit drugs at bus stops, in building entrances, etc. And so one of the things that VPD Deputy Chief Fiona Wilson said is that since they don't have this authority, they really can't do anything about public drug use. And what she had suggested at that time to the committee was that the province could bring in an exception or an amendment to Health Canada's exemption on decriminalization.
The exception to the exemption.
That's right, or an amendment, and that would effectively recriminalize drug use in certain spots, like bus stops. But so that was a suggestion by her, and she goes, that's something that they could do. I mean, of course, the opposition parties are saying, well, why don't you just end decriminalization altogether?
And remind us, the decriminalization project, when did it begin, and what does it involve?
So this project is basically a 3-year pilot, and it started about just a little over a year ago. And so it basically means that people can use a small amount of illicit drugs, let's say heroin, fentanyl. They can possess it and not be subject to criminal charges, basically.
Right. And we're going to get to that news conference, as we said, in just a moment. Mira, what has stood out to you being in the legislature in the past little while about this issue on both sides of the House and beyond?
Well, lately we've been seeing these leaked memos from health authorities advising nurses not to confiscate drugs. And so this has been really concerning because there are a lot of vulnerable patients in hospitals as well as healthcare workers. So it's some of these unintended consequences are what's being highlighted. And so that is really making the issue in the forefront of the public's mind, basically. So it's meant that the calls to end decriminalization have been growing stronger. And so with some of these memos, you also have some evidence that there is something going on in hospitals. And also that leads us to look at, WorkSafe reports, that there is official documents showing that this is a problem. And right now, one of the things is that people are not just injecting drugs, they're smoking drugs, which is creating a hazard for people around them. And so one problem I think one of the police chiefs had highlighted was, you know, what if someone is smoking fentanyl on a park bench at a beach. They do not have the authority to get them to move along. And so Premier Eby this week, especially yesterday, was facing a lot of criticism in the legislature and for calls to end decriminalization. And that was from BC United and the BC Conservatives, who are really gaining momentum in the polls. And we do have an election coming up,
Yes.
a provincial election in October. So that is one of the things that might be top of mind, especially if you're a political party.
And when we get to issues around data and results, and I think we're getting a 1-minute warning on this news conference, and again, we will bring it to you live. Do we have any data or results from this pilot project yet?
Well, that was a big question for Mental Health and Addictions Minister Jennifer Whiteside. And what she said was that there was an evaluation report on decriminalization that is being prepared. Now, she didn't say when it would be released, what exactly it would contain, and whether it would be released before the election. But remember, we're only about a year into the decriminalization pilot. And here
Yes, I think we're just about to start. We have the Public Safety Minister, Mike Farnworth. Here's the Premier. Let's take you now live.
Not quite that tall. Bring it down a little bit. I think we've got a new driver. You good? Okay. Thanks very much, everybody, for joining us this afternoon. We're on the territory of the Squamish, Musqueam, and Tsleil-Waututh people. I'm joined by my colleagues in Cabinet here this morning. We've got Minister Mike Farnworth, Minister of Public Safety, Minister Adrian Dix, the Minister of Health, and the Minister of Mental Health and Addiction, Jennifer Whiteside. We're also joined by senior police leadership in the province. We've got BPD Deputy Chief and BC Association of Chiefs of Police President Fiona Wilson. Thanks for joining us. Superintendent Wendy Mehat, Treasurer of the BC Association of Chiefs of Police and Ridge Meadows RCMP Superintendent. And Deputy Chief Tom Wolf von Gutenberg, West Vancouver Police Department and President of the BC Association of Municipal Chiefs of Police. Thank you for joining us here today. This month marks the 8th anniversary of the declaration of a public health crisis here in British Columbia, the toxic drug crisis. Since that time, we've had thousands of lives lost in the province. Brothers and sisters, fathers and mothers, friends, family members. As Premier and as in my previous roles as an elected official, met with many, many people who have lost loved ones due to this toxic drug crisis. The grief is real, and the search for solutions among those who are left behind, what could we have done differently, where could there have been support, is a search that we're sharing and a sense of urgency that we feel as government as a whole as well. Today I talked with Chief Joe Alphonse, who declared a state of emergency around the impacts of the toxic drug crisis in his community. Whether you're in a big city or in a small community, it doesn't matter. People are profoundly affected by this crisis. There is no question in my mind, having worked with many people struggling with addiction, that addiction is a health issue. It is not a criminal law issue. And that principle is what the entire decriminalization project was about. It was about removing the stigma for people struggling with addiction, preventing them potentially from reaching out to others to ask for help, to go to or to seek out treatment, or to admit that they're struggling for fear of arrest, for fear of a criminal record, for fear of consequences that would last their entire life. Our goal was to save lives, to remove that stigma, and to make sure that people had an opportunity to move forward and rebuild their lives. But that compassion, that concern for people who are struggling, does not mean that anything goes. we still have expectations around safety in public spaces, in the coffee shop, on the bus, in the park, on the beach, in spaces where people gather to celebrate, in businesses where small business owners are trying to earn a living. The drugs that we're seeing in our communities are more dangerous and more deadly than ever before. People have transitioned from injecting drugs to inhaling drugs. The impacts are very real on communities. Illicit drugs and hard drugs should not be used where kids are playing, where patients are recovering, where community life is lived. You will know that as a provincial government, to establish these guidelines, to set these firm but fair restrictions around where and when people should be engaging in hard drug use, were brought into the legislature in a bill that passed with the support of the Legislative Assembly and was taken to court, and an injunction put in place that prevented us from bringing it into force. This was obviously a challenging and a frustrating moment, and I want to assure people that that is not the end of the story. We hear you. We know that action needs to be taken on these issues. The resolution of that court issue is potentially more than a year down the road, and we cannot afford to wait. We need to act now. So today I'm here to announce that we are taking the steps that have been asked for by police, that have been asked for by members of the public, and that they deserve, to ensure that police have the tools in place to be able to address issues of street disorder, of public drug use, and to ensure the safety of people across the community, including those who use drugs. We today have made a formal request to Health Canada to amend the exemption to the Controlled Drugs and Substances Act, which will give the police the tools they need to enforce the law anytime someone is using drugs in an inappropriate location and compromising public safety. In short, this amendment will make public drug use illegal in British Columbia. I have talked to the Prime Minister about this. He assures me that the federal government will provide full support to ensure the police have the tools that they need. And this request also includes some exemptions. Drug use will not be banned in private homes, and for those who are sheltering lawfully in a private shelter. It will not be criminalized in overdose prevention sites where medical staff are present to support people. There's no question that criminalizing drug use costs all of us. It costs threats to lives, it costs money for prosecutions, and it doesn't make us safer. But police do need the tools to address extraordinary circumstances where people are compromising public safety through their drug use. In addition to this request to Health Canada, we're here today to share that we are also addressing the disturbing stories that British Columbians have heard about drug use in our hospitals. We will not tolerate the safety of health professionals or patients in our hospitals being compromised. Now, it's important to recognize that a number of patients in our hospitals go there struggling with serious addiction issues. They need health care just like everybody else. But again, this does not mean that we compromise the safety of health professionals or other patients in the hospital. Minister Dix will share the details of our action plan to address this issue, which includes no tolerance for illicit drugs in hospital outside of designated, medically supervised addiction treatment areas. In addition to these two components, we're also expanding resources for people who are struggling with addiction to help them rebuild their lives and exit from addiction. The first is we will be working to establish a virtual clinic option for what's called opioid agonist therapy. This is methadone, Suboxone, treatment drugs that assist people in dealing with the pain of withdrawal without having to use illicit street drugs. This virtual clinic will be available in every corner of the province and accessible to people through pharmacies to lower the barriers for people in smaller communities to be able to access treatment. In addition, the province funded Dr. Julio Montaner's Hope to Health Clinic in the downtown east side. This is a clinic serving about 1,000 patients in the downtown east side with serious addiction, mental health, and brain injury challenges. Dr. Montaner and his team have been tracking the outcomes and are showing remarkable impacts in improving the quality of lives of the people using the clinic and reducing the impact that those folks have had on the broader community through ambulance, emergency room visits, and police encounters. Today we're announcing an expansion of Dr. Montaner's Hope to Health clinics across the province of British Columbia. Many of you will know Dr. Montaner through his work in addressing the HIV/AIDS crisis in British Columbia. He's an internationally recognized doctor in this area. This announcement today builds on our work across the province to expand treatment and build out our treatment network. 600 publicly funded treatment beds, 49 community counseling agencies supported, in addition to the Road to Recovery model at St. Paul's Hospital, which we hope to bring province-wide. We know that there's more to do. We know that we need to do everything we can to keep people alive, to get them into treatment, to help them rebuild their lives. There is hope for people through treatment and recovery, and when people have that moment of clarity, when they reach out for assistance, we want them to be able to get it. We're committed to end this crisis in a way that saves lives and ensures safer and stronger communities for everybody. With that, I'd like to pass it over to Fiona Wilson for her remarks. Fiona?
Thank you very much, Premier Eby. My name is Deputy Chief Fiona Wilson of the Vancouver Police Department, and I'm also President of the British Columbia Association of Chiefs of Police. I'm pleased to be here today with Superintendent Wendy Mehat of Ridge Meadows RCMP, who is a fellow board member and also Treasurer of the British Columbia Association of Chiefs of Police. I'm also pleased to be here with Deputy Chief Tom Wolf von Gutenberg of the West Vancouver Police Department, who is President of our British Columbia Association of Municipal Chiefs of Police, along with all of our partners from the province. My colleagues and I here today represent the senior police leadership in British Columbia. Today marks an important moment for communities across this province as we address the issue of public drug consumption and the illicit drug toxicity crisis. As representatives of police agencies across BC, we stand united in our commitment to public safety and community well-being. We have always said that for decriminalization to succeed, it has to be part of a broader strategy to address the tragic consequences of the drug crisis that has killed far too many British Columbians. Treatment, education, prevention, and enforcement against predatory organized crime groups are equally important. We also understand that addiction is a complex issue that requires a compassionate and multifaceted approach, which is why we adopted a progressive approach to the decriminalization pilot. We understand the need to provide support and resources to those who are living with addiction rather than simply resorting to punitive measures. However, since day one, the British Columbia Association of Chiefs of Police has expressed significant concern with the issue of public consumption of illicit drugs. This concern is based on a fundamental belief in the importance of finding a balance between ensuring that people who use drugs are not unnecessarily criminalized, while all members in communities across this province feel safe at the beach, at a bus shelter, in parks, while simply walking down the street, and in places such as restaurants and hospitals. We have strongly advocated for tools for our members to effectively do their job while directing individuals who use drugs towards alternate pathways of care. We have listened to the concerns expressed by communities, business leaders, and individuals regarding public drug consumption. We are also acutely aware of the adverse impact of illicit drugs in rural and Indigenous communities. We've heard loud and clear from the frontline police officers who continue to see the unintended ramifications that unchecked public drug use has on the safety and well-being of neighborhoods. And the feedback has been unequivocal. Public consumption is a significant issue that needs to be addressed, and major changes are required. We have been vocal about our concerns raised about open drug use, and we welcome the new restrictions announced today, particularly for places where children, youth, and families are present. These measures are a step forward in addressing the concerns raised by our communities and the police officers who serve them. Let me be perfectly clear. We do not wish to stigmatize people who struggle with drug addiction. We do not support putting people in jail simply because they have a substance use disorder. We remain committed to a compassionate and health-led approach that supports people living with substance use disorder while also addressing the very real concerns in our communities related to problematic drug use. Today's announcement once again provides police in British Columbia with the tools we need to ensure families, businesses, and individuals can rely on us to support them in situations of problematic public consumption in our communities. We would like to thank the provincial and federal government for working to take these actions today and for listening to our concerns. Comprehensive training for police officers across British Columbia will be rolled out in the coming weeks to ensure these principles are maintained. The British Columbia Association of Chiefs of Police remains committed to working collaboratively with government agencies, community organizations, and other stakeholders to implement effective strategies that address substance use while prioritizing harm reduction and community safety. Together, we can create safer, healthier communities for all. Thank you.
I'd now like to invite Health Minister. Oh, sure. I thought you had notes. I was like, oh, are you speaking? Okay. I'd like to, at this point, turn it over to the media for questions.
For reporters on the line, please press *1 to enter the queue. When called on, please come off mute so we can hear you properly here in the room. Reporters are limited to one question and one follow-up. We'll start on the phone with a question from Richard Zusman, Global News.
This is for the Premier. Premier, is this an admission that decriminalization was a failure in this province? And should you have picked up sooner on these issues raised by municipalities and the police around the way that it was being dealt with here in BC?
Well, Richard, I share the concerns that so many British Columbians have about the public drug use that they're seeing in their communities. And it's clear to me that police need the authorities to be able to address this issue, as well as other extraordinary circumstances where someone's safety may be at risk. That should have been in place. It should have been there. And we, I think, lean too heavily on the idea that public intoxication could have been used as a tool. In addition, I'm obviously frustrated that our initial attempt to address this through provincial authorities has been tied up in court for an extended period. When we see this issue in our communities, I just want to assure people that we've heard you. We see those issues too. We want you and your family to be safe in community, and we're giving police the tools that they need to address this issue. And at the same time, our government, the police, and all British Columbians recognize that the people who are struggling with addictions are people that we love. But sometimes tough love is needed, and today's announcement is about establishing those boundaries to make sure that communities are safe and that even more tools are in place to help people rebuild their lives and deal with addiction.
Follow-up, Richard?
The courts ruled against you once before. Does this end the legislation that was put in place already and approved? And do you believe that you cannot be brought to court for the same reasons on these changes if the federal government, as you expect that they will, puts in place these exemptions?
So it obviously wasn't our choice to go to court on our provincial authorities to address public drug use or to have them subject to an injunction that prevented us from taking action in communities. That decision was taken by the plaintiffs in that action, and they're going to decide what happens with that court action, but we will defend, we believe, legitimate authorities on the part of the province to regulate drug use, including tobacco and alcohol, as well as hard drugs. For this initiative today, I do certainly think it's possible that we will see another legal challenge to this. However, in order for it to be successful, the court would have to find that the entire Controlled Drugs and Substances Act at the federal level was unconstitutional, and we think it's a very low risk. But there is still a risk, obviously. We believe we have the authorities to regulate provincially. We believe the federal government has the authorities to impose the Controlled Drugs and Substances Act, and we'll defend that if this does happen.
Our next question is from Mike Hager, Globe and Mail.
Thank you. Premier, can you just tell me when exactly you realized that this ban needed to come into effect? Like when and why? Where were you? What happened?
Sorry, Mike, it cut out a little bit. Where I was when I realized the ban wouldn't come into effect?
When and why did you realize this had to be done? Where were you? When did it crystallize?
I received a briefing from the Attorney General on the state of the litigation around our public use law at the provincial level that indicated that there was no end in sight for the injunction that restricts us from using that law, and that the case itself might drag out for as much as a year. Was one component. At the kind of government administration level, that we were being restrained from being able to use our own authorities. And the second piece was that the quickly escalating situation on the ground, particularly in relation to hospitals and use in restaurants, where it became clear that even the authorities that we'd attempted to impose at the provincial level would have to be expanded further. Made it clear that we were going to have to take a different approach with the federal government to approach them for amendments to the certificate. It was a combination of an administrative frustration with the court and a reality of a quickly escalating situation on the ground, and a growing concern that I share with British Columbians that hospitals, restaurants, communities need to be safe.
Follow-up, Mike?
Thanks. Sorry, when was the briefing on the injunction? And then maybe Ms. Wilson can answer. The guidance now will be for police not to arrest for simple possession unless it's exceptional circumstances. 6 months from now, what would be an acceptable increase in these arrests in your mind? Like what is palatable for you in terms of now a jump or an increase of people being arrested for simple possession? What could you stomach?
Yeah, I think, Mike, when we look at this, and I'll invite Fiona up to share the police perspective, but the goal is not a certain number of arrests or a certain number of drugs seized or from people struggling with addiction, these kinds of things. The goal is that police have the authority and that everybody in the community knows it, so they don't have to use it. That when a police officer says, no, I'm sorry, this isn't the place where drugs are used, you need to go somewhere else, the person listens and follows that direction, hopefully and ideally to a site where there are medical professionals connections to care, and potentially, if the person's in that space and ready, connections to addiction treatment. That's my preference. And the challenge that we've had, as I understand it from police and community members, is that under the current system, when police say, no, this isn't the proper location and you're causing a lot of concern with where you're using, that they don't have the tool to address that issue. They aren't able to back up that request with the authority that they need. And that's really the component here that I think is so vital, and what we hope this will achieve from the government level. Fiona?
Hopefully this will move down.
Yeah, it'll come down.
Might take a minute. Thanks for the question, Mike. It's Deputy Chief Wilson here. So, police have long used their discretion when it comes to matters of arresting people with respect to personal possession of illicit narcotics. We also follow direction from Crown Counsel that has been in place since 2020 that they will not approve charges in this province for simple possession except in extraordinary circumstances. So as a result, we've actually seen very, very few charges across the province for simple possession in the last number of years, and every year those numbers decline. We also know that people who use drugs, for the most part, go out of their way to avoid situations where they're doing so in front of children, families. However, our police officers do need to have legal authority to intervene in those rare situations where people are using illicit drugs under circumstances that are problematic. Families need to know that they can go to the beach and not have to tolerate someone sitting next to them ingesting illicit drugs, or go into a Tim Hortons and be confident that they're not going to be subjected to someone using drugs at the table next to them. So what today gives is police the authority to deal with those rare circumstances of problematic public consumption.
We'll go now to a question in the room from Brenna Owen, Canadian Press.
Hi there. Yeah, thank you so much.
You're with us here in the CBC Vancouver newsroom. Major update today from the Premier as well as police officials in BC. The BC government is now planning to make public drug use illegal in all public places, including hospitals, on transit and in parks, but with some exceptions, like in private homes and in overdose prevention sites. This is in response to concerns of public drug use in and around BC, particularly in hospitals, as we heard from police, where people and families may be concerned that someone on the beach is using illicit drugs beside them, and police were concerned that they were not able to tell that person to move along or say this is not an appropriate place. Let's go back to the news conference right now.
This is what I'm talking about. The initial provincial law that we introduced focused on common sense areas where people shouldn't be using drugs, in the doorways of businesses, bus stops, and so on. It became apparent that we would not only need to rely on those authorities, but we would need to add additional locations to our provincial law that was tied up in court. So we had to take this additional step of going to the federal government and working with them to use federal authorities and a blanket prohibition on public use, so that we're not moving from location to location in both public and quasi-public locations.
Follow up, Brenna?
Sure, thank you. To what extent does this represent kind of a reversal of some parts of the policy, if at all? And, in the kind of politicized atmosphere around decriminalization, what's your message for people who, might see this step differently to what you do?
Yeah, this is a very significant change on the ground in community in response to a situation that in communities none of us is going to tolerate, which is a situation where people feel unsafe in their parks or going to a local downtown business. We need to, as government, listen to and respond to these concerns when they're brought forward. There's no question that this issue has been intensely politicized, and that's a reality, especially as we lead into the election. But I think that most British Columbians agree, regardless of political stripe, that those who are struggling with addiction need support, need health care, need addiction treatment, and we need to lower the barriers wherever we can to do that. And that public spaces where that we rely on to be open and accessible for everyone, to ensure safe and strong communities, need to be safe. And it's those twin values that I think are shared by the vast majority of British Columbians that we're trying to achieve with today's announcement. Creating spaces where people are safe to call 911 if someone overdoses at a house and not worry about potentially being arrested. They feel safe going to a drug testing site, that they feel safe going to an overdose prevention site, that they're not going to be arrested or face seizure of their drugs, to encourage them into those appropriate responses, those public health responses, but to also address the safety of the broader community as well.
Our next question is from Monica Gould, City News.
Hi, yes, thank you. Just wondering more about the next steps. What has the federal government said in terms of the BC government's attempt to get this exemption from Health Canada? How will it take to get this exemption? And when officially will we see this ban on public drug use take effect?
We've been in communication with Health Canada and with our federal counterparts for a little bit now. They are fully expecting this request from us that was formally delivered today. The Prime Minister committed to me that the federal government would work with us to deliver this. Minister Whiteside met with her federal counterpart today. They discussed this in detail and underlined the urgency for British Columbians for the federal government to make these amendments. I believe we have a strong federal partner in this, and I hope to see these changes as soon as possible.
Follow-up, Monica?
Yes. Some advocates might point out that there are people who are homeless and experiencing or battling addiction, and they might not have anywhere else to use drugs, especially with this ban coming into place. And keeping in mind that there are not safe injection sites in all neighborhoods and in all communities, what would your response be to those concerns?
These are legitimate concerns that are captured in our request to Health Canada, where we recognize that the law has recognized that someone who's lawfully sheltering, who is homeless, that is their home, and that would also be exempted from our request to Health Canada.
We'll go back to the phone for a question from Les Lane, Times columnist.
Oh, thanks. Premier, you tried in the fall to recriminalize drug use in a number of specified public areas. Supreme Court and the Appeal Court said no, they rejected it. And now you want an even wider, it's just a ban on public use, period, which is far broader than what you tried last fall. You want Ottawa to do that. Why do you think if Ottawa does it, they'll have a better chance than the chance that the attempt that you made?
Thanks, Les. I'll get a little bit technical here just to clarify the distinction between what we're doing today and what we did through the legislation. Through the legislation, using our provincial authorities, we created an administrative offense of failing to follow the direction of a police officer when they tell you that you're not allowed to use drugs in a particular location. It was an effort on our part to address the public use issues while recognizing that at the provincial level we don't control the criminal law. The court looked at that and decided to put the injunction in place, and that court matter continues. The Controlled Drugs and Substances Act is a federal criminal law. It is tested almost daily in terms of its constitutionality by criminal defense lawyers across the country. It has been found to be constitutional again and again and again, including in communities that are hard hit by addiction, mental health issues, and our expectation is that while there is certainly a risk that someone will take us to court or take the federal government to court about the amendments to allow the Controlled Drugs and Substances Act to apply again for public use, that the risk of an injunction is low because of the fact that this law is tested so frequently and has been found to be constitutional so frequently.
Follow-up, Les?
Yeah, we're 14 months into a 3-year experiment, and you're making a massive change. You've said it's a very significant change. To the sort of impression that this wasn't very well thought out, given how dramatic the expansion is. Why didn't someone see this coming when, in all the work that went into this in the first place?
Well, Les, there's no question that there are two pieces here. One is clearly from the outset, we should have had these authorities in place for police to be able to deal with that. There were certainly technical challenges about doing that, where you're simultaneously saying this is decriminalized, there's not an offense, but police are able to seize drugs or arrest. So there were technical challenges to that, but it's very clear in hindsight that those authorities should have been there. The second is that the nature of the crisis is also changing. The way that people are using drugs is changing. They're inhaling drugs rather than injecting them. The drugs themselves that they're using are changing. They are even more toxic than before. We're seeing more and more people with serious brain injuries that are using publicly and whose behavior is erratic and concerning to members of the public. And so we also need to change our approach again. I absolutely accept the critique that we need to do more, that these authorities are needed and have been needed for a while. And we're putting them in place, and we're going to continue to do more to address this crisis because the safety of British Columbians, whether they're struggling with addiction or whether they just want to enjoy a nice day at the park, is our priority.
Our next question is from Jason Proctor, CBC.
Oh, yeah. I mean, even before this experiment, I mean, public drug consumption was an issue for many people in communities around BC. And, seeing the impact of drug use in terms of violence, prolific offending become a concern. And, the RCMP are facing a resourcing problem. I think about 1,500 vacancies around the province. Those realities are separate from decriminalization. So I'm wondering, I mean, at the end of the day, how much of a difference these changes are actually going to make to those concerns people have about the impact that drugs are having on their community?
Yeah, thanks, Jason. It would be a mistake to see this as enabling a big crackdown of a huge number of arrests or something like that. That's not where the police are at. That's not where the government is at. What this is today, it's not a silver bullet for the toxic drug crisis either, or the impacts that we're seeing in community. But it is a significant change in that we have seen behavior during this toxic drug crisis from people who are really struggling in a bunch of different ways, and also some criminal elements as well that we will not tolerate in this province, and that police need the tools to be able to address. And so this change, while significant, while important, will address those extraordinary circumstances and those situations that are really concerning to British Columbians when they see them. It is not the full answer, which is why we have also paired it up with additional resources for people who are struggling with addiction, with the Hope to Health clinic model rolling out across the province, with the virtual clinic for people to be able to access these treatment medications easily in communities right across the province. It will take an attack from all angles going at this to drive down the deaths and ensure safe communities, and we're going to keep doing that work.
Follow-up, Jason?
With regards to to Les's point, the Chief Justice in the ruling on the injunction case said laws forcing drug users out of public spaces might lead to death, financial and psychological harm for people already at threat because of addiction. And as you say, I mean, the Controlled Drugs and Substances Act is tested, daily in court. But, from a very high level here in terms of the Chief Justice of British Columbia, to what degree do you fear this has given sort of people who might want to continue this court battle some kind of impetus and grounds, certainly that they can point to take on the act?
Yeah, thanks, Jason. So I think that the litigation to date has properly considered the rights and the lives and the dignity of people struggling with addiction. What evidence hasn't been in front of the court, and that we will ultimately lead in that if the case does continue, and that we would lead in any action related to any of this, is the impact on communities of public spaces where people are using publicly, or where predatory drug dealers are using exemptions to undermine the safety of the community. That evidence also has to be in front of the court. And we'll make sure it's available to the court, whether it's in that provincial action or in any action that people bring forward, because there's a balancing piece of work we have to do here of having compassion for, concern for people struggling with addiction, getting the support they need, encouraging them to call 911 if someone is overdosed, encouraging them to use the safe consumption sites, and on the other hand, protecting the broader community as well, making sure that people feel safe and are safe in their communities, in their hospitals, in their coffee shops, and so on the bus. This is critically important as well, and the court, like government, needs to balance these sets of rights of two important and often overlapping groups.
We'll go next to Vaughn Palmer, Vancouver Sun.
If you're just joining us or getting you caught up, we're listening to Premier David Eby talk about the BC government's plan to again make public drug use illegal in all public spaces in the province, including hospitals, on transit, and in parks, but with some exceptions, like in private homes and overdose prevention sites. The Premier taking questions for the past number of minutes. He says he accepts the criticism that there were concerns around the drug decriminalization pilot. The police felt they didn't have the power to ask people to move, for example, off a transit bus or at a park or at a beach if they were sitting next to a family. Much more, and we will have much more on our website as well, cbc.ca/BC. But I want to bring in our legislative reporter, Mira Baines, who's been watching along with us and covering this over the last number of months in the legislature. Some major changes to public drug use announced in the province. What are they, Mira? Recap.
This is very significant. So if Health Canada approves these amendments to the health exemption, which allows decriminalization, it basically means that the use of illicit drugs will be illegal in public spaces, which include hospitals, restaurants, transit, parks and beaches, bus stops, like you mentioned. Police will have the authority to compel someone to leave the premises, or they'll be arrested if necessary. And that's a power that the police didn't have before. And so they've been really emphasizing their concerns. They emphasized it to a House of Commons Health Committee, and now we saw VPD Deputy Chief Fiona Wilson also attend this youth conference and speak about now having this authority and how it will change things. And she expects those changes to be rolled out in the coming weeks once they're approved. And Premier Eby said that he expects them to be approved as soon as possible. He said that there's already conversations that have been taking place with the federal government on this issue. And I should emphasize that under this pilot, the pilot is still continuing. May I remind you, we're only about a year into it. And so people will be able to use illicit drugs in private homes, overdose prevention sites, where they're legally sheltering, and also drug checking locations. So that's pretty significant.
Now, those are, when we talk about police and the changes there, that's on the enforcement end. We also know the province announced some changes to expanding treatment options. What were they?
Well, one of the biggest problems with treatment, and especially with this explosion of opioid overdoses and across the province, has been remote communities and Indigenous communities. How are they dealing with it, and do they have the tools? So one of the things is the province is going to be setting up virtual clinics to help people in remote areas access medication for assisted treatment. And they also brought in some rules for hospital drug use, that it will only be allowed in designated areas.
You've been knee-deep in this politically at the legislature and elsewhere, monitoring this for months. What sense and tone, perhaps a change, did you sense in the Premier today? Anything?
Well, we see a change in the direction. a course correction perhaps on the decriminalization pilot from Premier David Eby, but there hasn't been a major shift in the way he talks about it. He says that this issue needs to be treated like a medical issue, that we need to have more compassion. We need to remove the stigma around drug users, that they need to be kept alive in order to seek treatment. And so while he said he accepts criticism, which was very interesting in itself, he said that this decriminalization pilot is a search for solution because BC has been seeing thousands and thousands of deaths due to the overdose crisis.
All right. Mira Baines, we appreciate your time and your analysis as always. Thanks very much for joining us. And thank you for joining us here from the CBC Vancouver newsroom on our streaming channel. As you just saw, the Premier speaking about major changes to public drug use, essentially making it illegal again in BC with some exceptions. You can read much more about this on our website, cbc.ca/BC. Tune into CBC Radio 1 all afternoon and check us out at 6 o'clock and 11 o'clock on CBC Television. I'm Dan Burwood. Thanks for joining us. This is CBC News, BC.